Welcome, and thank you for watching this presentation about the AwareDoc Diagnostic Profiling application. It is our goal to show you how this application can help you explore the differential diagnosis process. Some background. A great challenge in clinical training is the development of the differential or list of potential diagnoses. This process is difficult for several reasons. 1. Initial education in medicine is typically oriented by disease systems. The trainee starts from a named disease and then connects to that disease the associated symptoms, signs, and test values. Yet, when trying to diagnose a new patient, the clinician collects symptoms, signs, and test values for the patient and based on that information tries to identify the possible disease. Essentially, the clinician now has to work backwards to find the disease. 2. Building differential diagnosis is also complicated by concepts of probabilities, especially for the prevalence of disease. Imagine a patient suffering from an intermittent fever for the last 2 days. First, it may be useful to think of all the diseases that have fever as a feature. Possibilities include infections, autoimmune disorders, atelectasis, pulmonary embolism, and cancers. Understand that as more information about the patient is gathered, it may be possible to develop a better sense of what is the disease. Finally, the diagnosis can be established once there is adequate information to satisfy the criteria for the diagnosis. A student can use the AwareDoc Diagnostic Profiling application, the DPA, to explore the differential diagnosis process. A test patient can be selected, and the user of the DPA can enter information about this patient. As each finding is added to the hierarchical list is updated according to the number of symptoms, signs, and test results that satisfy the criteria of diagnosis. Once enough criteria are matched to make the diagnosis, the disease name is highlighted in the list of possible diagnoses. The DPA user can explore the differential process by adding and removing findings. For example, it's possible to try to make diagnoses without test results, or see what happens when cough is present with sputum production, and again when sputum is not produced. Meanwhile, the DPA can show the criteria for making each diagnosis, suggest testing workups to help make the diagnosis, and offer a list of questions that would normally be part of the review of systems that would further support the particular diagnostic decisions. Using the DPA. When you start the application, the patient list screen shows the list of patients of different ages and genders. You can choose from this list to begin developing your differential diagnoses. Once you select a patient, the name and date of birth are presented in the top left bar. Now click on the Diagnostics Profile tab. There are 2 main panels for your attention on the Diagnostic Profile screen. The Items panel is on the left, where you enter your findings about your patient. The upper large panel represents the differential diagnoses. They will be ranked by the number of matched diagnostic criteria. There are a number of links that can be selected in any diagnostic line to see information such as the criteria for diagnosis, suggested workups, other diagnoses that share some of the characteristics of this diagnosis, and questions to ask the patient that may further support this diagnosis. At the top bar, there are 2 buttons. The Delete Patient Data button, which can be used to clear all the data for this patient only. This allows you to start your work for this patient from the beginning, and the Enter Vitals button, which when pressed will open a pop-up where you can enter vital signs for this patient. The bottom main panel is the space for the past medical history. It is not enabled in this version of the Diagnostic Profile application. Now to begin, you may enter vital signs for this patient. Try the following. Press the Vital Signs button and enter. Temperature 101 degrees Fahrenheit. Pulse of 86 beats per minute. And blood pressure of 150/90. You can also then direct your attention to the Enter Signs, Symptoms, and text box to type. As you type, a list of possible search matches are provided, and you can select one of these items, or you can complete your typing. The search routine can find words in any position in the item phrase. If you want to add this item to the patient's data, then click on the Add button. If you want to clear the text box, such as to modify or change your planned item, press the clear button and you can again start typing. When you click on the Add button, that information is used to find possible diagnoses which are shown in the current diagnosis panel. If you wish to remove symptoms, and only those symptoms that you have entered and not saved, you can check the Clear Only Symptoms box at the bottom of the Items box. Each diagnosis is displayed in the current diagnosis panel in the order of if a diagnostic criteria has been fully met for that disease, and then according to the number of items that are matched. Indeed, these items are the signs, symptoms, and test results that you use to establish the diagnosis. For each disease listed, you can choose to learn more by checking in the cells for 1. A summary of matched and unmatched findings needed to make the diagnosis, the diagnostic criteria for this disease itself, differential diagnosis for this disease. This can help you extend your thinking further as other diseases that are related to this disease are shown. These disease names will be added to the higher standing than those of the current disease if you do select them, clicking in the text boxes. Some workups, use some tests which are useful establishing this diagnosis. Codes, which provide either ICD-9 or SNOMED codes which are used to identify this diagnosis. And questionnaire items, which are suggestions which can help you make the diagnosis and usually be part of a focused history of present illness or a review of systems. You can also enter lab test information in the items box. We will add a potassium test result of 2.4 millimolar. When a diagnosis is confirmed, the entire line of this named disease will have a red background. You can return to the Patient List tab at any time to start working on another patient by either clicking on the Save button or the Discard button. When you click on the Save button, all the information you have entered is saved, allowing you to work further on this patient when you enter via the Patient List and click on the Diagnostic Profiling tab. If, however, you do not want to save this most recently entered data, you can click on the Discard button. After either choice, you will then be brought back to the Patient List. There are two other ways of removing data you have entered into the system. When you are viewing the diagnostic profiling page, you can select on Delete Patient Data. When you do this, only the data for this patient will be deleted. On the Patient List screen, if you go back to that tab, you can click on the Delete All Patient Data at the top bar. When you do this, all the data for all patients listed will be deleted. This essentially lets you start completely over from the very beginning as if no one started any work on these patients. You can then see that by exploring the patterns of symptoms, signs, and test results, the DPA can present to you possible diagnoses. This is the differential. And you can see how some of the diseases are more or less likely based upon the number of matches to the diagnostic criteria. Please try this application with real and simulated patients that have been of interest to you. You can see how, again, the differential changes depending upon the signs or symptoms or test results are discovered. Thank you very much for your attention, and I hope you enjoyed working with this application in the future.